Well, good afternoon, everyone. I want to begin today with first providing my condolences to the people of Buffalo, Mayor Byron Brown, who are mourning the loss of 10 individuals who were taken senselessly because of someone bent on racist conspiracy theories. What we know now, and we've always known, is racism is lethal. We also recognize that the use of firearms in this country can be lethal. And the question is, how many more times will this continue to happen in cities and towns and suburbs across this country? So there are families without grandmothers today. There are people who are just living their life like we live our lives, just going to the grocery store to pick up a few things, to make a shortcake, to make dinner one evening, and now they're not here. And it was driven by hate. We have to look ourselves in the mirror sometime and ask, what's going on here? And how we can be part of the solution instead of part of the problem. And so my heart is heavy today for the people of Buffalo. I have family in Buffalo. I have two first cousins who live 5 minutes and 2 blocks away from Tops. And so obviously I text them frantically, wanted to see where they were. And they're fortunately safe. But all of our hearts should be heavy this Monday afternoon after dealing with such an cowardly act in our country. I want to begin today, move towards talking about our public health, our status when it comes to COVID-19. Here are a few numbers for the city of Richmond. The Department of Health states that the city of Richmond has seen 46,445 cases of COVID-19 since the beginning of March 2020. Cases continue to decline, and our 7-day average of new daily cases is at 76.7. And as is custom, I'd like to take a moment of silence to remember those we've lost to COVID-19. We've passed the 1 million person threshold, 1 million deaths in the United States of America, and we've had 515 community members lost to COVID-19 here in the great city of Richmond. I ask that we take a moment of silence in remembrance of them. Thank you. And as always, you can learn more about vaccination and testing opportunities by going to www.vax.rchd.com or by simply calling the health hotline with the Richmond City and Henrico County Health District at 804-205-3501. Now, I don't see Dr. Veray with us today, but we do have a representative from Richmond City Health District. No, not today. Well, we will not. We'll have Dr. Veray come back next week to talk a little bit about the health district and where we are on as we continue to thwart off COVID-19 and the pandemic. Well, another issue around the country I think that many of you all have heard about is the formula shortage, the baby formula shortage. You may wonder why this is a priority for me, the mayor of the city of Richmond. Well, not only do I care about our children here, our children and families here in Richmond, I'm also the chair of the U.S. Conference of Mayors Children and Health and Human Services Standing Committee, and I'm also the co-chair of the Mayors Alliance to End Childhood Hunger as well. So I spend a lot of time listening to the critical needs of American families. And this is a crisis for 75% of American families of infants who are at least somewhat dependent upon formula for nourishment. In Richmond, right here locally, we're hearing pediatricians that are overwhelmed by calls from families who have gone to 10 stores or so and haven't found anything. So they've been turning to unsafe methods like mixing Carnation instant breakfast or even Karo syrup. This crisis is starker for families of infants with dietary restrictions and for families who benefit from the WIC program, women, infants, and children. We know our WIC families have faced greater challenges because until recently, only one formula manufacturer was approved by WIC. That manufacturer is Abbott, which makes the Similac brand, and which implemented a massive recall and closed a factory in February due to contamination. Now, thankfully, in April, the Virginia WIC office provided temporary approval of alternative formula brands so that families dependent on WIC can feed their babies could access more options as well. And I applaud the WIC office here in Virginia for this initial step because now WIC families have multiple options for formula in any store that is a WIC vendor. Today, I'm calling on the leaders of our Commonwealth to go even further. And I'm asking for two things. First, I want our Commonwealth leaders to extend the WIC alternative formula approval indefinitely and to expand the approved list to include as many options as possible. Bottom line, no baby should suffer because of a monopoly. WIC families deserve the same options as affluent families in the Commonwealth of Virginia. My second request, I'm asking for the Commonwealth's leaders to act immediately to declare a state of emergency for Virginia families in order to trigger the Commonwealth anti-price gouging statutes designed to protect consumers from paying exorbitant prices for necessities during an emergency. I cannot think of a greater emergency than the inability for families to feed their babies. And I hope Governor Youngkin, a parent himself, feels the exact same way. Now, at the local level, here in the city, I'm also directing the city's Office of Children and Families to develop a plan of action to support WIC families in particular. I'm pleased to share that my team is already working with a couple partners. We're working with the Robbins Foundation and Urban Baby Beginnings to invest a total of $45,000 to this specific purpose. I want Richmond's infant caregivers to know that help is on the way. We know that a formula shortage is an added stress to an already demanding job as a mother, as a father, or as a caregiver. So I want you to know that the city of Richmond, this administration cares about you, that we love you, and we're going to do everything we can to help during this crisis. Now today, I am joined by Elliot Haspel from the Robbins Foundation. And Elliot, would you like to add a couple of comments to what we're trying to do here in Richmond to help our local families and infants? Elliot.
Thank you, Mr. Mayor. My name is Elliot Haspel. I'm a program officer at the Robbins Foundation, and I'm here representing the foundation on behalf of myself, my colleague Courtney Rice, and our CEO and president, Dr. Christopher Chin, who's out of town today. So the Robbins Foundation is committed to early childhood education for all Richmonders, and we know that having adequate nutrition is crucial to infants' health, including their cognitive development. But we also know that this crisis impacts the mental health and stress level of caregivers. I say that as someone who knows the research and as someone who's a father myself, and that in turn also impacts child development. We're grateful to the mayor, we're grateful to the Richmond City Health District, we're grateful to Urban Baby Beginnings for their partnership as we work to expand formula access for all families. And we echo the calls that the mayor is making for permanent solutions so that this type of a situation never arises again. Thank you, Mr. Mayor.
Thank you, Elliot, and we appreciate our partners at the Robbins Foundation. And I think we just collectively believe that in a crisis like this that involves part of what I would consider the most vulnerable in our population, our infants, our children, that we should do everything we can to get them through this crisis, just like we've done over the course of the last 2 years when I think about it, right? We've done everything I think we've done everything we can to get our residents through a pandemic, and now to be dealing with this another crisis on top of that. This is where government has to step up. And so, once again, we're grateful for the work of the Commonwealth thus far, but we are asking, obviously, for us to do more. And we join in the mission in doing more. It's obvious that we here at the local level, we can't build factories or otherwise address the supply chain issues. But we can help ensure that our most vulnerable families have access to formula to feed their babies while we wait for the federal and state governments to do what they can as well. I would be remiss if I didn't say I was grateful to Speaker Nancy Pelosi, her most recent Dear Colleague letter on this matter, and I'm hopeful that the House of Representatives will grant an emergency authority to the WIC program to address supply chain disruptions and recalls. Switching gears a little bit, as you can see with the announcement today, our Office of Children and Families is staying pretty busy recently. We've always said from day one of this administration that our children are our greatest asset in this city. And that's the focus of the Office of Children and Families. Last week, we announced more than $619,000 in grants to expand child care here in the great city of Richmond. And this is in addition to the $500,000 to Smart Beginnings of Greater Richmond for child care and preschool expansion as well. This means over 250 new child care seats for Richmond families. That's a big deal. It's a huge deal. We also announced a $50,000 grant to the Children's Museum of Richmond to expand access for low-income families, and a $50,000 grant was also awarded to the Children's Funding Project to study costs and financing strategies for universal preschool in the city. Remember, my goal as a candidate in 2020 was to universalize preschool here in the city, and we are working towards that goal. I've got 2 years and 7 months left, but who's counting? But I'm very goal-oriented, and this is a good goal for the city of Richmond to meet. We are committed to ensure that our kids have a safe, affordable, and high-quality care opportunities here in our city, and we're going to do everything we can to give them those opportunities. So, with that, we'll take a few questions.
Mayor, I guess two questions. One, in your request for the governor to declare a state of emergency and all that, have you sent any kind of transmission to him or communication to him, or is this how you're communicating it to him at this point in time? I'll do that question.
The question was, and thank you, Henry, for that question. Have we sent any sort of formal transmission to the governor's office just yet? I don't believe we have, but something will be coming. And it's our hope that here's the thing. We know that the governor and state government, they're doing everything they can as well to meet the moment of this crisis. And we see ourselves as partners in that mission to meet the moment. So it's my hope that, yes, we've laid out a serious request to them, but it's our hope that they are willing to partner and do everything they can to make sure infants don't go hungry in the Commonwealth of Virginia.
You can go around.
Yeah, just the follow-up, the solutions that you talked about were kind of about setting up the city of Richmond for success moving forward to make sure that we don't face this kind of crisis again. So is there something that we can be doing on the local level, even just community members, to do their best to ameliorate this issue right now?
Well, a great question, Olivia, about whether or not there's something that we can be doing as a community right at this moment. For us, as you saw, our focus as the administration is going to be specifically on those WIC families, because remember, the families, those who are currently part of the WIC program, have to focus on a specified list that's offered through WIC. As a former cashier, I've had to tell families that, no, you have to take this back and go down the aisle. Just imagine walking into a grocery store right now to go pick out some formula for your child, and the section that you are only allowed to pick from is totally empty and gone. You have to walk out of that store empty-handed back home to your family. What we want to do as an administration is expand those options for those WIC families who are participating in that program. And we're lucky enough that there are those in the philanthropic community who are willing to step up, as well as those in the nonprofit community who are willing to step up. So I've seen the generosity of this community before. It's been on full display over the course of the last 2 years. And this is just another way that Richmonders from all walks of life are stepping up. Ellie, do you want to add to that in terms of what Robbins is doing?
Yeah, so similar to what Mayor Stoney said, obviously philanthropy can't generate more supply of formula, but we do know that there is a financial issue here. So because WIC is so restrictive, the other part of the restrictions on WIC is you can use it almost nowhere online. And so, again, formula supply nationwide is very low. It is not zeroed out. And so one thing that we're really looking into is how can we provide potentially some direct financial support to these lower income families so that they have a wide variety of options to go to vendors that don't currently accept WIC at all, to shop online, things like that, to hopefully expand their options, just to get them through so they're not forced to take desperate measures, which we know can have real threats to infant health.
And Olivia, I'm going to ask that Eva Colin, the director of our Office of Children and Families, to add to that as well.
Thank you, Mayor, and thank you, Elliot. Olivia, great question. And just to the question itself of what can we as Richmonders do, number one, if you are purchasing formula and you are not on WIC, do what you can to buy those options that are not WIC restrictive. So when you go to that shopping center, take the extra step to look and see if there's a purple sticker on the price label that says WIC on it, because that means that somebody has no other options. You might be able to. So as somebody who, I fed my son formula when he was an infant, it takes an extra step because I might automatically just buy that brand I'm so comfortable with. But if I can take that step and say, okay, wait, there's a store brand, like Target's Up and Up brand is not a WIC approved item. I can buy that one for my son, and somebody else can buy the one that's WIC approved. So I'll just add that one. There's also a burgeoning group on Facebook and social media where people are helping each other find formula. So that's at the most grassroots level, but I encourage folks to check that out as well. But I would say the biggest thing is if you're feeding your infant formula and you don't need WIC, try to pick an alternative if at all possible.
And just to follow up to that, I know you had spoken about how many Richmonders rely on this. Do we have a rough idea of how much of our population is WIC reliant?
We have, the rough estimate we've received is about 1,000 families are on WIC in Richmond. We are still cutting those numbers on the mayor's directive to try to figure out how we're going to support families. We're trying to determine how many of them are infants and are using formula, but that's where we're really zeroing in on that 1,000 families that are benefiting from WIC.
And I was just, this might be for you as well, just following up on this joint effort here for the people hearing about this and this $45,000 that you're putting towards this. Can you speak to, I guess, what you're looking at doing, how quickly you're hoping to do something, wherever that is?
Sure. So the first step is putting this money out into action. So we're partnering with Urban Baby Beginnings. Again, the question was how soon? What are we doing with this money? We are looking to Elliot's point, find ways to create other options for WIC families. So at this point, we're investigating what options might exist through a third-party partner like Urban Baby Beginnings that's able to partner with the city to receive funds, either in procuring formula or identifying ways to offer benefits to families directly. We're working on that, and we'll have a plan to update soon.
And then, earlier offices put out something about personal property taxes and helping with that increase. Can you speak to what exactly is happening here? Because I know the surrounding counties are doing some of the things.
Yeah, the question was about personal property taxes and the administration putting something out on that front. Yes, we know that the counties have also done something to provide some relief to those who are paying their personal property tax in the city. It's something that we have to look at as well. It's obviously, if something's occurring in Henrico and Chesterfield, the likelihood of it occurring in Richmond is still very high as well. And so we want to do what we can to provide some relief to our residents as well. And so it's my hope that it's enough. Obviously, sometimes you never know, but we know that the markets out there is with inflation and whatnot is it's been rough on everyone. I think we're talking about the shortages here. We know how much gas is now. These things start to add up, and we want to make sure that particularly the residents who are who lack resources also have the ability to pay their taxes as well. Anything else? Thank you, everyone.